I'm Tim Malloy with the Palm Beach Civic Association. It is March 24th, the afternoon, and here's our update on the COVID-19 virus in conjunction with the town of Palm Beach. We're working together on this. We mentioned at length yesterday the police concerns with the density of people on the lake trail in Palm Beach, a terrific stretch that runs along the Intracoastal. Too many people on it, and the concerns have now led to drastic action. There are times when there are bicyclists, bikes, kids, joggers, runners, all breathing on each other. It's too close, so some decisions have been made, and here's what they're going to do. From 8 a.m. to 5 p.m. every day, only walkers, runners, and cyclists 12 and younger will be allowed on the lake trail. Again, from 8 a.m. to 5, only walkers, runners, and cyclists 12 and younger will be allowed on the lake trail. Cyclists 13 and older can ride the trail before 8 a.m. and after 5 p.m. Police will restrict parking in the main entrances to the lake trail. Those measures are being taken to ease the overcrowding and help those using the trail maintain the recommended social distancing 6 feet that has not been happening. And this is important. For any of you who may have family or friends flying in from Connecticut, New Jersey, or New York, you should be aware of a quarantine order issued yesterday by Governor Ron DeSantis. Any person flying into Florida airports from those 3 states where COVID-19 has reached a high level of community spread must self-isolate for 14 days on entry to Florida. They'll be fined if they're caught. While most hotels either have closed or plan to soon, the town of Palm Beach is asking all hotels and vacation rental properties to close to limit the unintended spread of COVID-19. There are now 101 confirmed COVID-19 cases in the county of Palm Beach, 3 deaths. There are 4 suspected or confirmed cases in the town of Palm Beach. Now, today was a big experiment. Publix opened their markets all over the state, in NRA in particular, to older people over 65. We have more on that from my colleague Wendy Rutledge, who talked to the head of the Publix here in Palm Beach about the stocking of shelves and how things are going generally.
Hello, I'm Wendy Rutledge with the Palm Beach Civic Association. Today, the Palm Beach Publix began a brand new program. It is the Senior Citizens Shopping Hour from 7 a.m. to 8 a.m. It happens now on Tuesdays and Wednesday mornings. Today was the first day. In order to find out how it went and also information about supplies on the shelves, Tim Malloy contacted the general manager, Greg Sirkin, and has this interview.
Greg, how are we doing today? Here we are on a Tuesday. We're kind of in the teeth of things. What's going on in town?
Well, things were calming. Yesterday was a relatively normal Monday over here at the store. This morning's been a little hectic. We had our first hour of senior sales, or senior hour this morning, which drew a very large crowd. One of the busiest opening hours we've had since this whole thing started. So that got us going a little bit, but it's calming a little bit and getting a little bit back to normal now.
Tell me about supplies for everybody. Are we pretty well stocked these days, or is it tough?
No, we're I would say as far as bakery, deli, produce, meat department, we're like 90-95%. You're going to miss some ingredients here and there, but overall, you're going to be able to get the majority of the items you're shopping for. In the center store grocery, there are no categories in the store that are completely wiped out, at least at this moment. You're not going to have the variety.
Right.
You're just not going to have the variety. And the one thing that we have not been able to acquire is any quantity of like sanitizer or Clorox wipes, things of that nature. Those things that we're getting them. They're trickling in, and they're not lasting long.
And paper products.
Paper, actually, this is the first day. Today is actually the first day that we've made it a full 24 hours with toilet paper on the shelf.
Okay. And
that seems like it's going to be that way. Unless something happens, we should be okay. Better than we've been. Very
important to give great praise to your guys there, your women and men. How are they holding up? Because that's not an easy job on a good day. How are they doing?
No, they're doing well. I couldn't be more proud of the team. They're holding it together. They're working their butts off.
Yep.
So far, so good. Thankfully, we've had no one that's come down with any kind of serious symptoms or anything like that. So all's good on that front.
Great work, Greg. We'll be talking to you soon. As you know, if you've been following this, and we hope you have, Maggie Zeidman is, of course, a nurse from New York for many years, the head of the nursing at Lenox Hill Hospital in New York, and, of course, one of our leaders on the town council. She's uniquely qualified to talk about town dealings as well as health concerns, and she's been doing that every day with a little bit of inspiration as well. So here's the latest from Maggie.
Good afternoon, everyone. Today we want to do something a little bit different. I'm going to talk about symptoms, but first I want to give you a little bit of an update on some very important things that have happened. First of all, I want to point everyone in the direction of the Town Manager 3 p.m. update, Monday through Friday. I think it's very important that you go online to listen to this, and you can do so at townofpalmbeach.com, townofpalmbeach.com. And you'll see there that it says Town Manager Update, and click on audio. It might take you a few tries, it did me, but you'll get it down. So try to do that early, maybe about 5 minutes to 3, and see if you can get on. There's a lot of information. Every day they go over the caseload, they go over what's happening in Florida, what's happening in the county, what's happening here in town, things that might be closed or where we have changed guidelines, for example, today on the lake trail. So it's worth your while to take a listen to that. So it's 3 p.m. every day, Monday through Friday, and it's the Town Manager's Update. Okay, another thing happened today. We had senior morning, and I know that this is going to be covered by the Civic Association, so I'm not going to spend a lot of time on it, but Publix tried to do something really good to open up an hour early so seniors could get in there and get shopping and maybe have some distance. Problem is, a lot of people came at one time. So just as a reminder for tomorrow, if you're going, you really do need to keep 6 feet apart from each other. That's something that's actually been studied. If someone sneezes or they cough or even just breathing, these droplets that have the virus in them can be out up to 6 feet. So you really need to do that. So stay away from each other. If you're going shopping or you have to go to the drugstore, well, you know, I said drugstore, do the drive-through, but get deliveries. If you're going there, 6 feet. That's what you have to do. Our Mayor Caniglio has mentioned to me a few times now that we should be reaching out to people who might live alone, people who are by themselves, who are probably feel very isolated, and she has suggested a buddy system. And I think this is part of like just being kind to others. Think about people who might be alone, and also think about people who are isolating themselves because they are sick. They are then quarantining themselves for 14 days. And by the way, if you've come from New York, if you've come from Italy, if you've come from any area where there's a high incidence, and that includes Boston, you need to isolate yourself. You should do that for 14 days. And also those who are have been on cruises. So be kind, be a friend, make that list today so that tomorrow you can start by calling people. Just touch base with them. It will be very much appreciated. And don't forget those who are sick. They're scared. They're afraid that it's COVID-19. It may not be, but they don't know because we don't have enough tests. I thought today, because I'm asked a lot of questions about symptoms, that we should go over a few things just as a review. And you know, the symptoms have widened over a period of time. So it's spread by respiratory droplet. That's why you're staying home, because if you stay home, then you should not be getting sick unless you're living with someone who already has COVID-19. So there's a question that's come up about aerosols, and does the virus linger in the air for a period of time? There was one study, I've looked this up, there was one study done, and it was done under controlled conditions in a laboratory, and it said that it hung in the air for about 3 hours. Now, those are called aerosols. Those are medical, they're medical procedures, suctioning, intubating someone to put them on a ventilator, doing a tracheostomy, doing a bronchoscopy. That's where you have to be concerned about aerosols in the air for a few hours. And as I said, it's known in the medical community, but this was done with COVID-19. That's not something that you're going to be exposed to. It does live on surfaces, and they've tried it on many different surfaces, so that's why you're being asked to disinfect things more often. The incubation period now is still 14 days. It looks like 4 to 5 days after exposure, because there are now large groups that they can look at, unfortunately, in Italy and in France, Spain, Germany. The United States is getting right up there. I mean, we are moving right up into number 2. So they've had a large experience now, and you can say that after you have been exposed to it, about 4 to 5 days later, that's when you start to feel the symptoms. And the spectrum of the illness goes from mild to very critical. So mild is about 80% of people, you know that. Severe is about 15%. That's where you have some difficulty breathing. And critical, you have respiratory failure and you're going to be admitted to the ICU. Whether or not you have to be on a ventilator, not everyone is, and that's about 5%. So these stats, though, may vary by location. They vary by demographic, whether you're in a vulnerable group. So for older adults, you know, we're still considered the vulnerable people. So let's take a look at the symptoms. Now these are done again in larger groups now, so we have more information. So fever occurs in about 99%, fatigue in 70%, dry cough 59%, anorexia, which means that you don't feel like eating, 40%, muscle aches 35%, dyspnea. That's when you you may have pneumonia, but you may just have an inflammation in the lungs from the virus. That's in 31%, and sputum production in 27%. Other, less than these percentages, are headache, sore throat, a runny nose, nausea and diarrhea, which may be a presenting symptom, and loss of smell. So it also seems like the condition gets worse as days go on. So around day 5, 6, 7, and 8, you may feel a little bit difficulty breathing. And I think that's important to know, because in the beginning it may seem mild, but by day 5 it may be worse. So I think that you need to think about that, and if you have these symptoms, don't assume, call your doctor. So what do you do if you do have symptoms and you're concerned that it's COVID-19? So if you have traveled to an area where there's a high incidence, or if you've been in contact with someone who's been in an area of high incidence of COVID-19, or you just suspect that you have been around someone who has COVID-19, or your symptoms seem to match the COVID-19, call your doctor. The other things that are being set up, because some doctors' offices may not be open, out of courtesy to their employees and sending their employees home so they can stay at home and shelter in place. There's also telehealth. There's Baptist has telehealth, and Cleveland Clinic, and I'm sure there are others. So I'm not here to promote one or the other, but you can actually go online, and if you have a camera, or you can use your phone, or you can use your iPad, they can see you and they can help you. Of course, also you can call the CDC or the Department of Health. There's also a CDC website that goes over the symptoms, and I tried it out myself yesterday. It's pretty cool. You put in your, what you feel, and it asks a lot of questions, so you could try that too. Where you have to really be careful is if you're having difficulty breathing. If you have difficulty breathing, you need to call 911. They're going to ask you questions. You don't want to expose them to COVID-19. If you expose them to COVID-19, they're going to have to quarantine for 14 days, and we cannot have our first responders out for 14 days. We need them. So you're going to be asked questions. Oh, you have a cough? Do you have a fever? Do you have a respiratory distress? They're going to ask you that. It's important that you answer those questions honestly. They will be there for you, I can assure you. So I think that tomorrow we might focus a little bit on home care if someone does have symptoms, but I wanted you to at least let's review the symptoms and see where we are. I'll see you again tomorrow. Stay home, stay away from people as much as you can, and be well.
I'm Tim Malloy with the Palm Beach Civic Association. We're working very closely with the town of Palm Beach, the police, fire rescue every hour. And so we'll update this website whenever we can. We advise you to please, after this is over, this video, scroll down. You can see the full town report with the very latest, some of which we touched on. We wish you well, stay healthy, we're with you, and we leave you with some video of a tranquil Atlantic Ocean.